This presentation is brought to you by one of the most significant concerns in clinical nutrition, namely dysphagia. All the data in this presentation has been cited and referenced according to the APA format. To begin with, what basically is dysphagia? The term is constructed of two words, dys, which means difficulty, and phagia or phagus, which means swallowing or ingesting. It is a medical condition in which an individual finds it difficult to swallow foods or gulp liquids. Not going in detail about the signs and symptoms of this condition, largely coughing and choking while eating or drinking are the most common symptoms seen in dysphagic patients. The pictorial representation below gives a clear-cut demarcation of a normal esophagus and a dysphagic one. Now moving on to the phases of swallowing. Generally, there are four phases: the pre-oral phase, the oral phase, the pharyngeal phase, and the esophageal phase. The pre-oral phase, which starts with the anticipation of food being introduced into the mouth, followed by the oral phase where the food is mixed with saliva to form the bolus. The third one is the pharyngeal phase, which initiates the process of swallowing. Next to that is the esophageal phase, where the bolus is transported via the food pipe or the esophagus to the stomach by undergoing peristalsis. Apart from that, we have alternative feeding routes. Describing in brief, these feeding routes are used in situations where the nutrient needs are high and the patient's appetite is poor, or the patient is unable to meet the nutrient needs orally. The two large alternate feeding routes are the tube feeding, which is also known as enteral, or the intravenous feeding, which is also known as parenteral. Under the tube feedings, the delivery of the nutritionally complete formulas through a tube placed into the stomach or intestine is initiated. Under the intravenous feeding, the delivery of nutrients via the vascular system or the veins may be used when the patient's condition prohibits the use of GI tracts to deliver the nutrients. Now talking about the dysphagic drinking devices, these equipments are used generally by the patients suffering from dysphagia. Since they cannot swallow food or liquid properly, these devices help them to do so. The four commonly used devices are the Capitex Dysphagia cups, the Capi cups, the Novo cups, and the Drink Rights, safer hydration delivery. The first one are the Capitex Dysphagia cup. The Capitex Dysphagia cup is oval shaped to allow the sufficient nose clearance to empty its contents without having to tilt the head back while you are drinking. These are suitable for warm and cold fluids and thickened liquids. These cups are weighted to help reduce spills for patients with tremors. One-piece construction with a wide handle to allow extended palm is the most significant characteristics of the Capitex Dysphagia cups, since they help in maintaining a good grip. These cups are supplied with a detachable base for extra stability. The second one are the Capi cups. The Capi cups has a cutout on the non-drinking side so that they can be tilted without interference by the nose. These are medium and large size cups and are supplied with a double handle holder. A choice of single or double handle holders is also available. These cups are suitable for warm, cold, and thickened fluids. The third one are the Novo cups. The Novo cup is ideal for people whose head and neck movement is restricted and is an excellent choice for dependent patients. These cups are suitable for warm and cold fluids and stage 1 thickened fluids. These cups are dishwasher and microwave safe. These cups avoid the spill since these are spill-proof, clear plastic beakers so contents are visible. These cups contain up to 250 ml liquid with measurable markings. The last one are the Drink Right Safer Hydration Delivery. The Drink Right system provides a controlled limited flow of the liquid of 5 cc or 10 cc into the mouth without the drinker having to tilt their head. It is ideal for domestic as well as nursing home use. It is available in cup or beaker options, each with 5 cc and 10 cc inserts. It's suitable for users who cannot tolerate thickened fluids. A safe option for users with dementia or learning difficulties to prevent the gulping, drinking too quickly is also available.